is Dr. Patrick Moran. I'm a pediatric intensivist at Prevea Health. I'm always going to be focused on the patient, which is the child, and so incorporating parents' wishes and goals along with our team's goals while we navigate to get kids home and out of the hospital. I also rely a lot on our nurses, our respiratory therapists, our patient techs, care managers, social work. It's a multifaceted discipline, and so I'm only a small part of that, and really using all those resources to help make sure our patients and families are having the best experience while they're with us. It's really hard to leave after taking care of kids for a full day and not feel fulfilled, and I really appreciate interacting with the families as well. I think that's a really unique aspect of our field. The intensive care side of it in particular, something that's just incredibly stimulating to me, I think, always keeps me on my toes, which is appreciated. I think we also have a unique privilege of caring for patients and families when they're kind of at some of their worst times, and can help guide them through those for better or worse. I think that's, again, that's one of the unique highlights of pediatrics in particular, and I think that's something that's really important to me when I'm caring for my patients, my children, is building that relationship with the parents, making sure they're kind of walking alongside our care team and sharing those decisions that we're making when we're caring for their children.